Okay, okay. Perfect, perfect. I think I'm audible and visible to everyone over here now. Yes, I'm audible and visible to everyone over here now. Yes, anyone just give me a thumbs up in the chat box if I'm audible and visible. Hmm. Akhilesh, very good, beta. Hmm. Abhi, very good. Osama, yes. Okay, I don't know. There was some technical glitch. There was some technical glitch in the previous session. So please, let's continue over here and don't like we shouldn't waste time over here. Right? I hope the audio and visuals are perfectly fine. So just give me a thumbs up in the chat box if the audio and visuals are perfectly fine, guys. Right? Now, in the parietal lobe, now we were discussing about the parietal lobe, guys, right? And we were discussing about the somatosensory cortex, that is the main sensory area, that is the 3, 1, and 2. Shakil Ahmed, very good. Very good, guys. Very good, very good. Not an issue, guys. Not an issue. Please continue. Don't, yes, Raghu, fine. Okay, perfect, guys. So, just let me once more check what is, yes, I hope it's not from my end. चलो कोई दिक्कत नहीं है ठीक है yes I hope it's fine now guys we were discussing the another area guys over here and that is something okay over here yeah, over here here you can see another sulcus guys you can see another sulcus and we have already discussed about the sulcus yesterday and that is called as the interparietal sulcus which is now coming from this yeah middle of this post central sulcus and going to the occipital sulcus so it is dividing into two lobules superior parietal lobule and inferior parietal lobule okay we have already discussed this now now guys just see over here in this particular picture so we have this yes the interparietal sulcus okay interparietal sulcus and over here we have another area guys that is the 5 and 7 and this is called as the somatosensory area or the association cortex somatosensory association cortex right somatosensory association cortex now guys if this is the interparietal sulcus if this is interparietal sulcus you guys are going to tell me the 5 and 7 they are located in which lobule guys the 5 and 7 they are located in which lobule guys just give me the answer in the chat box the 5 and 7 they are located in which lobule guys yes I'm waiting for your answers and you already know the answer guys yes the 5 and 7 they are located in the superior parietal lobule okay we have the superior parietal lobule very good yes we have the superior parietal lobule and that is the yes you already know somatosensory association cortex so let us just write down the in the parietal lobe we have discussed the somatosensory now coming on to the next one guys that is the yes the somatosensory association cortex somatosensory association cortex and that is the areas 5 and 7 areas 5 and 7 now guys what is the site you already know it is in the superior parietal lobule superior parietal lobule right superior parietal lobule now what is the function of this particular cortex can anyone tell me what is the function of this particular cortex now guys now this particular it is basically related to knowing the meaning of sensations knowing the meaning of sensations right just a moment knowing the meaning of the sensations right knowing the meaning of the sensations okay felt now basically this is by associating the or I can simply say by associating visual okay, by associating the visual part, right? The visual part, okay, by associating the visual part, right? So that is you have to remember even the auditory, or I can say the tactile sensations, right? Or I can say the tactile sensations, right? So by associating the visual, auditory, and tactile sensations. Now, how this? Now, guys, the function over here, in short, it is basically the primary sensory area or cortex. I mean, sorry, I'm saying it is the sensory association area. Okay, it is the sensory association area. Now, guys, what is this? What is this so important over here? Guys, I can see an object. If suppose any object is coming to me, right? I can see that object, right? I can see that object. So you already we have the visual area, but was what exactly that object is, what it can do to me, right? Anything about that, like no, that knowledge about that object is stored in my previous experiences, okay, or in my association areas, right? Whenever you say like visual association or auditory association or simply sensory association, so this is like sensory association, guys. So they are related to the previous experiences, or they are related to the past memory, guys, okay, which will help you guys to recognize, okay, that particular thing based on whatever like sensory stimulus you are using that time, right? So even like either by visual or by auditory, just I told you, or by even touching it, guys, by touching it. So if there is any injury, guys, to the sensory association area, if there is any injury, if there is any injury, or I can say if there is any lesion, guys, right? So what it can lead to, it will lead to tactile agnosia, okay? So that is it will lead to tactile agnosia. Right now, what does this mean? It is basically the inability to inability to recognize the felt objects, okay, which are basically like recorded in your previous memories or past experiences, right? So that is stereognosis. That is something called as stereognosis, right? Now, stereognosis basically means the disturbed body image, okay? Inability to recognize the position of the body, right? The patient may feel that right half the body is in the left half, so that is something like the parts in the space, right? So that is something you have to remember over here, right? So that is about the somatosensory association cortex, and that is located in the superior parietal lobule. So I hope this is clear, guys. I hope this is clear. Just give me a thumbs up in the chat box if this is clear to every one of you. Yes, if this is clear to every one of you. Yes. चलो फटाफट से एक थम्स अप दे दो चैट बॉक्स में, जल्दी से एक थम्स अप दे दो चैट बॉक्स में. Shakil Ahmed, very good, beta. Now we are going to discuss two very important areas over here. Two very important areas over here. Okay, we already know we have one. Yes, we have the superior temporal gyrus and we have the medial temporal gyrus, right? Now on the posterior limb of this, we have an arc-like shape we have discussed yesterday. Blossom, very good. We have an arc-like, arched-like area over here. Yes, we have discussed this, guys. That is the supramarginal gyrus, right? This is the supramarginal gyrus, and we have angular gyrus also. We have angular gyrus also. Basically, it is on the superior temporal sulcus. तो देखो ऊपर क्या है, लेटरल सर्कस है. लेटरल सर्कस के ऊपर एक आर्च जैसा जो एरिया दिख रहा है, इट इज बेसिकली इन द स्पेराइटल लोब ओनली, दैट इज द सुपीरियर सुप्रामार्जिनल गाइरस. एंड ऑन द सुपीरियर टेम्पोरल सल्कस, सल्कस के ऊपर ही देखो बस, we have this angular gyrus, we have this angular gyrus, right? So we are now going to discuss the two important areas in the parietal lobe. Yes, Okay, let me just write it over here also. That is area number 39 and 40. We have area number 39 and 40. Now, if I ask you where this 40 is present and where this 39 is present, can anyone tell me in the chat box where this 40 is present and where this 39 is present? चलो फटाफट से बता दो. अभी बताया, जस्ट अभी बताया. फटाफट से बता दो where this area is present. चलो, let us try to write about this. Yes. Yeah, the third and the fourth one which we are discussing together, basically we have the angular gyrus, that is, yes, the motor areas. Okay, okay, the areas are basically 39 and 40. This 39, what is the location, guys? What is the location of this 30? This 39, actually you already know it is the yes, this is the angular gyrus, right? It is the angular gyrus. And this 40, guys, yes, yes, very good, Shakil Ahmed, very good, beta, very good. It is the supramarginal gyrus, supramarginal gyrus, right? So that is the location is very much clear. Now, guys, what is this? What is this? Totally, basically, these both areas. If you just try to notice, these both areas are basically okay. Let me take this pen. Yeah, these both areas are component of sensory speech area. Sensory speech area, or it is also called as the Wernicke's area. It is also called as the Wernicke's area. It is also called as the Wernicke's area. Yes, yes, Dr. Akhilesh Singh, you are right. It is also called as the Wernicke's area. Okay. Now, guys, what is the okay? If we just try to see the function of this 39, guys, what is the function of this 39? It is basically the visual, auditory conversion area. It is the visual, auditory conversion area, right? Conversion area. No, guys, remember what is this 39 doing, guys? It is basically receiving. It receives. Okay, if I'm just talking about this 39, guys, what does this 39 is doing? What is the function, guys? It is receiving input visual impulses. Okay, input visual impulses from areas like 18 and 19, guys. Okay, from areas 18 and 19, and projects them to Wernicke's area. Wernicke's area, guys. So yes, that is something you have to remember, guys, so that it receives this input visual impulses from the areas 18 and 19, and it projects them to the Wernicke's area. Now over here guys, any injury, guys, over here, if there is any injury or like lesion to this particular area, what it will lead to? It will lead to agraphia. Okay, it will lead to agraphia. Now, when I say agraphia, guys, agraphia means inability to express thoughts while writing, right? So it is inability to express thoughts while writing, right? So the person will be unable to know express his thoughts while writing, right? So that is one of the thing that you have to remember. Apart from that, guys, you can also remember dyscalculia. Okay, so now, what is this dyscalculia? Let me just try to write this word that is called as dyscalculia. Calculia basically means the calculator, guys. Now this person is unable to do the basic sums. Okay, difficulty with difficulty with arithmetics, arithmetics, inability to do simple sums. Simply means it is inability to do simple sums, guys. Inability to do simple sums. That is dyscalculia, right? So that is something you have to remember, guys. That is something you have to remember. And I hope this is clear. This area number, yes, 39 is clear to everyone. And yeah, the 39 is clear. Just give me a thumbs up. Yes. Now this area number 40, it is basically surrounding the posterior ramus, posterior part जो था lateral sulcus का, right? The ramus of the posterior sulcus, right? So it is arching around the posterior sulcus. So that is the supramarginal gyrus, right? So basically, what is the function? It is again, it is having like the same function, guys. Yes, let me just try to, yeah, blossom, very good. Let me just try to highlight what is the function of this, what is the function of this 40 over here. It basically interrelates. Yes, blossom, Shakil, very good, beta. It interrelates, guys, like all the visual, auditory, okay, and the sensory stimulus. Interrelates sensory, visual, and auditory stimulus. Auditory stimulus, right? Now, injury to this, uh, okay, it will be leading to one syndrome, I mean, one condition, guys, over here. And remember, if there is any injury over here to this particular or any lesion is there, guys, remember it will lead to apraxia. Apraxia. Now, what is this apraxia, guys? Apraxia is basically inability to perform any purposeful movement. Okay, any purposeful movement. Okay, for example, we have ideomotor apraxia. Basically, if you are not able to do simple salute, okay, to like perform the complicated motor task like the saluting, okay, and that can be ideational apraxia also, which is inability to use objects. Okay, so yes, now, like whatever tools are now like basically placed in patient's hands, if it's not able to use them, that is ideational apraxia. Facial expression apraxia can be there. Okay, inability to perform the facial oral movements like licking the lips. Okay, like any simple thing, right? So that is the apraxia, guys, that you have to remember. Hmm. So that is about this 39 and 40, right? So I hope this is clear to everyone. Yes. I hope this is clear to everyone. Just give me a thumbs up in the chat box. Now guys, in physiology we say Wernicke's area. If I just simply say the Wernicke's area in physiology, it is 22. Now guys, again, now which is very much correct, guys. I won't say it is incorrect. Okay, now area number 22, it is the auditory association area. Okay, now I will be talking about this. Vishal Singh, very good. It is the auditory association area. It is now connected by the arcuate fasciculus with this 39 and 40. There is a fasciculus, there is a bundle which is connecting this 39 and 40 with this 22, and all these three, basically 22, 39 and 40, guys. Yes, Vishnuvardhan, very good. So basically all these 22, 39 and 40, they are the parts of Wernicke's area only. In physiology, you might have encountered the Wernicke's area is 22. It's correct, absolutely correct. Basically, this 22, or we call it as auditory association area, it is connected to 39 and 40 with the help of some fasciculus, guys. Okay, with help of some arcuate fasciculus, and we'll be discussing that fasciculus, no need to worry. So these all three, the 22, 39, 40, these are the parts of Wernicke's area only. Now, if all these 22, 39 and 40 are damaged, guys, if these are damaged, it will lead to sensory aphasia. Okay, it will lead to sensory aphasia, right? Sensory aphasia, right? So that is something you have to remember over here. So that is about this parietal lobe. In the parietal lobe, 39 and 40 we have discussed. We have discussed areas number 5 and 7, right? We have discussed in the post-central gyrus 3, 1 and 2. 3, 1 and 2. So I hope this is clear to each one of you guys. Just give me a thumbs up in the chat box if this is clear. If this is clear, the 5 and 7 is done, 40, 39 and 3, 1 and 2. That is all the areas in the parietal lobe. In the parietal lobe. Yes, Mohammed, good evening. Good evening, beta. चलो फटाफट से एक थम्स अप दे दो if this is clear to everyone. चलो शकील, very good, very good. Now coming on to the most important, that is the temporal lobe, guys. Coming on to the most important one, that is the temporal lobe. And in the temporal lobe, let us just discuss. We have over here the areas number 41 and area number 42. Area number 41 and area number 42 in the temporal lobe, guys. So over here, just try to remember, we have this area number 41, and surrounding this area, guys, surrounding this area, we have area number 42, area number 42. We have 41 and we have area number 42. Now, guys, if we talk about, yes, 41 and 42, guys, you already know this is the superior temporal gyrus. Okay, and we have the middle temporal gyrus, right? Superior temporal gyrus, middle temporal gyrus, and we have the inferior temporal gyrus. We have one more line over here. And yes, below we have the inferior temporal gyrus. So basically the 41 and 42, they both are located in the superior temporal gyrus only. Now, if you see this 41, it is basically located exactly in the middle of the superior temporal gyrus. And that is given a special name. It is known as Hessel's gyrus. Okay, that is given a special name, and that is called as Haeckel's gyrus. So let us just try to see this, guys. Yes, over here. Sure. So we are now discussing the temporal lobe. Temporal lobe. And in the temporal lobe, guys, the very first one that we have to discuss, it is the areas number 41 and 42. That is auditory sensory area. Auditory sensory area. That is area number 41 and 42. Area number 41 and 42. Right? So remember, guys, it is basically present in the superior temporal gyrus. Yeah, it is in the superior temporal gyrus in the middle part. So what is the site, guys? It is in the middle of superior temporal gyrus. Superior temporal gyrus, right? Or it is also called as the Hessel's gyrus, right? It is also called as Hessel's gyrus, right? So it is given a special name. It is the Hessel's gyrus. Now, what is the function of this particular part, guys? Auditory. So it will receive auditory radiation. It receives auditory radiation, guys. And from which part? It receives auditory radiation from the medial geniculate body. I will be coming to this medial geniculate body. And you already know this medial geniculate body we have already discussed in the superior colliculus, the inferior colliculus, the medial geniculate body, the lateral geniculate body, and I hope you guys remember that. So we will be discussing this thalamus and all that later on. Yes, Vishnu, very good, guys. So it receives the auditory radiations from this, yes, the medial geniculate body, and guys, any injury, guys, remember, any injury, guys, or any lesion to this particular area, okay, there will be now, if there is unilateral obstruction, or I can simply say if there is unilateral destruction, सिर्फ एक ही साइड का हुआ है, then it will result in only partial deafness. It will result in only partial deafness, guys. Okay. So basically, you already know we have bilateral cochlear representation. So you just have to remember, if there is only unilateral destruction, it will lead to partial deafness. right? So that is something you have to remember over here, right? So that is the primary auditory cortex, right? So it is also called as, yes, the primary auditory cortex, auditory cortex, primary auditory cortex, right? Now, again, guys, around this, guys, you already know we have, yes, the area number 22. Yes, we have the area number 22, guys. Yes, let us just try to locate this. So not this around, not this 41. It is 41 and 42 combined, guys. Okay, let me just erase this and tell you. Yes, this 41 and 42, it is like over here only. 41, 42, and surrounding this primary auditory cortex, we have area number 22. Area number 22. So 41 and 42 are in like the same gyrus, that is the Hessel's gyrus. I mean, and the surrounding this, we have the area number 22. We have the area number 22. So that is something you have to remember. It is like the posterior part of, can you just see it is like surrounding this 41 and 42. So that is in the superior temporal gyrus only. So let us just write down about, yes, the other one in the temporal lobe, that is, you already should know, it is auditory association area. Auditory association area, and remember that this area is area 22. Okay, site again remains the same. It is the superior temporal gyrus. Superior temporal gyrus, guys. It is the superior temporal gyrus. So basically, I already told you this 22 basically includes no, the Wernicke's speech area. Now this Wernicke's speech area, it is basically connected to the Broca's area, right? I have already told you this 22, it is basically connected to this 39 and 40 by some arcuate fasciculus, via some arcuate fasciculus, right? Via some arcuate fasciculus, and that is basically called as the Wernicke's area. Okay, this 22. Yes, combinedly it is called as the Wernicke's area, right? So remember this. Now, if there is injury to this area, guys, what will happen if there is any injury? Now, let us first discuss what is the function of this area, guys. Can anyone tell me what is the function of this area? Now remember, guys, it is okay. Remember, guys, it is no responsible. No, obviously not. Saichand. No. So it is responsible for knowing the meaning of the sounds. Knowing the meaning of the sounds. Meaning of sounds. Right? So that is the function of this auditory association area. That is, it will help in, it is responsible for knowing the meaning of the sounds, right? So basically, injury of this area, guys, I've already told you it is the dominant hemisphere, right? The area in the dominant hemisphere will lead to Wernicke's aphasia, right? Now, the patient will find difficulty now in understanding the spoken language, or speak faster than normal, or will have difficulty in finding the right words to express himself. So that is the injury of this particular area will lead to. That is the injury of this particular area will lead to, right? So remember, guys, injury will lead to Wernicke's aphasia. Wernicke's aphasia. So here the patient will have difficulty, and simply you can write the patient will have difficulty in understanding spoken language. In understanding spoken language, guys. Okay. The patient no will speak faster than usual. It will speak faster than usual. And no, it will has difficulty in finding the right words to express himself, has difficulty to find right words to express himself. The patient will have difficulty to find the right words to express himself. So that is regarding this auditory association area. Now that was about the temporal lobe, that is area number 41, 42, and 22. So I hope this is clear, guys. I hope this is clear. Just give me a thumbs up in the chat box if this is clear, guys. So yes, I hope this is clear, guys. Yes. चलो फटाफट से एक thumbs up दे दो. I'm waiting for your thumbs up, everyone. Yes. चलो एक thumbs up दे दो जल्दी से. चलो blossom, very good. Shakil, very good, very good, very good, guys. Yes, very good, guys. So let us just, I will be discussing the occipital lobe like more in the medial surface of the cerebrum, right? So right now guys, Tasfiya, Tabassum, Dr. Akhilesh, Shakil, Blossom, very good guys. Be with me throughout, beta. Yes, you have to like write and understand. So guys, till now what we have discussed about the functional areas. We have discussed the superolateral surface. Okay, we have discussed the superolateral surface in detail, guys. So the superolateral surface is done, right? We have already discussed the superolateral surface. Now we will be discussing the medial surface, and we will be discussing some important, yes, gyrus and sulci in the medial surface, and some important motor or sensory areas in the medial surface, guys. In the medial circuit surface, guys. So let us just discuss the medial surface of the cerebrum. We have already discussed the superolateral surface. We have discussed in the superolateral surface, right? We have already discussed in the superolateral surface all the sulcus and gyri. We have discussed all the important functional areas according to lobe wise, right? All the motor areas, right? We have discussed in the parietal lobe, we have discussed in the temporal lobe. Now occipital lobe is left, but in the occipital I will be showing you on the medial aspect, guys. Medial aspect. So let us start with the medial surface of cerebrum. Medial surface of the cerebrum. The medial surface of the cerebrum, guys. The medial surface of the cerebrum. Now, can anyone tell me how we will take the medial surface, guys? We have two cerebral hemispheres. Now, what I have to do, I have to take a sagittal section. I have to remove one cerebral hemisphere. Then I will look from this side, and then I will be able to see the medial surface. Medial surface is the one which is located towards the midline, right? So that is something, yes, we have to discuss over here. That is the medial, the sulci and gyri of the medial and tentorial surface, right? I'll be discussing the tentorium surface also, right? So yes, without wasting much more time, let us just try to. Now we have to take this medial surface with the help of a structure that is called as corpus callosum. Okay, we cannot like forget to take the structure, guys, over here, and that is guys, you already know we have this corpus callosum over here. Yes, we have this structure that is called as corpus callosum, right? And yes, then we have to like take this. Okay, let me just draw this here a bit nicer. So yes, Now let us just try to look at this medial surface, guys. Look at this medial surface. Now, guys, you will see a sulcus which is running parallel, okay, which is running parallel and above this corpus callosum, right, which is running parallel and above this corpus callosum, right, and you will see that sulcus basically it is no turning upward like that, and this one yes, remember guys, this one, yes, it is called as the okay, let me just try to show you this. Okay, let me first show you the sulcus. Okay guys, let me first show you the sulcus. Okay. Now, above the corpus callosum, guys, you will be okay watching a sulcus that is now running parallel, okay, and above this corpus callosum, and this corpus callosum, basically the sulcus will be running upwards also, right? And that this sulcus over here, it is called as the cingulate sulcus, guys. Okay, this is called as the cingulate sulcus, right? This is called as cingulate sulcus, guys, right? Cingulate sulcus. Yes, so we have like two, it's dividing into two, guys, like this. The two arms are like this. These are the two limbs of the cingulate sulcus. So remember, guys, this cingulate sulcus is basically running parallel. It is running above the corpus callosum, and basically it is dividing like this. It is dividing like this, right? So, guys, you can very well see that in between these two limbs, you will see like there is one projection, guys, over here of the cingulate sulcus, and this projection, it is nothing but the central sulcus. We have already discussed the central sulcus in detail, guys. We have already discussed the central sulcus in detail. So there is a little bit projection, guys, which you can see on the medial surface also, right? There is little bit projection which you can see on the medial surface also, right? So central is basically present on the central sulcus, basically it is present on the superolateral surface, we have already discussed, but a small projection, a very small projection, it is seen on the medial surface. And this projection over here, because it is important, because the area around the central sulcus and the limbs, guys, this area which I'm talking about right now, this area, guys, if you can just see between the limbs of the cingulate sulcus and guys, yes, the central sulcus, which is around the central sulcus and between the two limbs of this is called as the paracentral lobule. This area, it is called as the paracentral lobule. It is called as the paracentral lobule. Just give me a thumbs up, guys, if this is like you understood this, guys. Ki cingulate sulcus will basically start, okay, it will run parallel to this corpus callosum, it will go upwards and it will be dividing into two limbs. Okay, we have the central sulcus in between, which is present on the superolateral part. Only a small part will be shown here, and the area around the central sulcus bounded by these two limbs of the cingulate sulcus. This yellow colored area, it is called as the paracentral lobule. Just give me a thumbs up, guys, if you understand this. Now, this paracentral lobule, it is very important, guys, from the exam point of view. Very important. Put dollar sign over here. Dollar is very important. It is at the highest center, guys. Remember, guys, it is the highest center for micturition and defecation. Micturition and defecation. It is the highest center for micturition and defecation. Yes, Shakil, very good. Blossom, very good. Now the gyrus, guys, which I was like highlighting earlier, now this particular gyrus, which you will just see like below this a cingulate sulcus, guys. This gyrus. What will be the name of this gyrus, guys? Yes, you already know this is the, yes, this gyrus which is below the cingulate sulcus. And this gyrus, it is no running upward also, running like going backward. Yes. Below also, yes. This gyrus, it is basically called as the cingulate gyrus. Please mention it over here. It is the cingulate gyrus. Now, now, this is the cingulate gyrus, guys, right? Now, if you see the continuation of the cingulate gyrus, guys, on the posterior part, okay, if you see the continuation of the cingulate gyrus, जो पीछे की तरफ जा रहा है, guys, right? It's going behind, guys. You can see there is a connection, okay? There is a connection, okay? Isthmus, okay? This area, guys, that is called as the isthmus. That I basically stands for the isthmus. This isthmus is basically connected. You should remember, guys, this isthmus, it is connected to the para hippocampal gyrus. Over here we have a gyrus again. And remember, guys, that this gyrus, it is called as the para hippocampal gyrus. Hippocampal gyrus, guys. Para hippocampal gyrus. So the cingulate gyrus basically communicates to the para hippocampal gyrus via this projection. That is the isthmus. That is the isthmus, guys. Now this anterior upward part, guys, the turned upward part of this para hippocampal gyrus, okay, it is called as uncus. It is called as the uncus, guys. It is called as the uncus, right? It is called as the uncus. It is called as uncus. So what is this uncus? It is nothing but the anterior. Okay, but obviously this is the anterior part and we are going from anterior to posterior. This anterior upturn, ऊपर की तरफ जा रहा है, turn हो रहा है. Of which part? The parahippocampal gyrus, that is something called as this uncus, right? So it is the lateral relation of the cavernous sinus. Apart from the cranial nerves, this uncus was outside the cavernous sinus, which you remember, guys, right? So I hope this is clear as of now. Just give me a thumbs up, guys, if this is clear to every one of you now, right? If this is clear to every one of you now, just give me a thumbs up. I'm waiting for your thumbs up in the chat box, please. Hmm. Chal, I'm waiting. Yeah. Okay, perfect. Just let me know if it's done. Chalo, Shakil, very good. Very good. What about rest, guys? Yes. Robin, very good. Very good. Now over here, guys, over here, we have, yes, we have another areas or another gyrus also, guys, right? Now anteriorly, guys, anteriorly, you should remember we have like two gyrus which you have to remember, right? We have like two gyrus over here. This gyrus, okay, this gyrus, it is okay. It is called as the para olfactory gyrus. Para olfactory gyrus. And the one which is more inside, more deep, it is called as para terminal gyrus. Para terminal gyrus, guys. Para terminal gyrus. Right? Now, areas which are encircling the corpus callosum, guys, you can see the para terminal Okay, we have the para-olfactory gyrus, right? We have the cingulate gyrus, we have the isthmus, we have the hippocampal gyrus. Okay, so that is, and which is anteriorly presenting this uncus. So these are all the gyruses which are encircling this corpus callosum. These are all the gyruses, guys, which are encircling this corpus callosum. That is something you have to remember over here. Okay. So that is about over here, guys. Over here, like you have to like we have, okay, we have calcarine sulcus, right? So remember, guys, this is a deep no arch sulcus over here. Okay, basically having two parts, the anterior and the posterior part. So this is the calcarine sulcus, guys. Okay. We have like two parts which are now meeting each other at the right angle. So it is like bounded by these three. Yes, yes, we have this calcarine sulcus over here, right? So yes, we have the three areas over here, guys. The one which is more closer to the sulcus, it is 17, then 18, and then 19. We have 17, 18, and 19. Guys, remember 17, it is the primary visual area. Remember 17, it is the primary visual area. 18 and 19 are visual association area. 18 and 19 are the visual association area. 18 and 19 are the visual association area. So that is again you have to remember over here. So 18 and 19 are basically the visual association area, right? Now, I hope this is clear, guys. I hope this is clear, right? So that is something you have to like remember over here. These are the major ones which we have discussed in the medial surface. And first you can also remember it is area number 28, guys. It is for the primary olfactory area. Okay, it is primary olfactory area, guys. It is primary olfactory area. It is the primary olfactory area, guys. Right? Chalo. I think that's enough for today, I suppose. We have already discussed, guys, yes, the medial surface of the cerebrum. We have discussed the superolateral surfaces, right? We have discussed this, right? So let's end up this today, and tomorrow we will be starting with the white matter of the cerebrum, right? We will be starting with the white matter of the cerebrum, and I will be starting with the other parts, right? I will be discussing firstly the histology of the cerebral cortex, the homunculus. Okay, I will be discussing the types of sulci also, which I have just like not discussed. Yes, so I will be like discussing it tomorrow as well. Okay, so let's end up this, right?